And first we'll have the invocation. Counselor Snell would offer the invocation for us, please.
Rise, please. Gracious Heavenly Father, thank you, Lord, for this day. Be with us, Lord, as we go through the health committee meeting today. Give us knowledge, give us wisdom, and bless the attendance we have today. Thank you, Lord. Amen.
Thank you. Roll call, Shelley.
Janelle Fulbright.
Here.
Dick Clay.
Here.
Bill England.
Here.
Jack Baker. Joe Bird. Julia Parks. Jody Fishinghawk.
Here.
Meredith Fraley. Don Garvin. China Glory Jordan. Frankie Hargis.
Present.
Chuck Hoskins Jr. Lee Keener. Curtis Snell.
Here.
David Thornton.
Present.
David Hawkins.
Here.
Kara Calvin Watson.
Honey.
We do have a quorum.
Thank you. Next, we need a motion to approve the minutes.
So made.
Moved and second. All in favor, you know, say aye.
Aye.
All opposed, same sign. The minutes are approved. Next is the report from the Claremore Service Unit, Mr. George Valuers. Welcome, Mr. Valuers.
Good afternoon. Our report shows, we're $2 million collected over above and beyond what we did last year at this time, so we're doing well. Visits are up, collections are up. Any specific questions?
Yes, Councilor Watts. Go ahead.
Thank you, Madam Chair. How, from your perspective, how is the new contract health service working? What are the issues internally and externally
The program with
for
Cherokee
Cherokee
Nation,
Nation citizens?
I hear nothing about it. As far as I know, it's running smooth. We set up Brett and two of the contract health ladies in NOAD, I believe, so that they could go into our system and pull those denials and defers out and then run them through your system. And once we got them set up, I haven't heard that we've had any problems at all with the technical end of it.
Okay, thank you very much. Thank you, Madam Chair.
Any other questions, comments? Okay, thank you, Mr.
Thank you.
Valuers. Next is Ms. Connie Davis with Cherokee Nation Health Services. Ms. Davis.
Good afternoon.
Afternoon.
Do you have any questions about the health report?
Yes, Councilor Watts. Go
Thank
ahead.
you, Councilwoman. Connie, so from your perspective, what are we facing on the new contract health service special dividend, both the 5% and the airplane? What are the issues that our constituents are seeing and that your staff are seeing? How do we anticipate working through those? And what should we anticipate on the next reports?
Well, I'm hoping to have a more detailed report at the request of the council members from your area
Okay.
as far as who's being served, the denials, and district issues, where they're coming from. I think we have an opportunity to educate the providers there at Claremore on better documentation that will help get some of those referrals approved quicker. That's when we see the word denial, it's not that they're not ever going to be done, it's just we need more medical documentation in order to refer them out properly. And I've asked Dr. Stillberg to coordinate with Dr. Nachi an education opportunity there.
And when we go through this, are we sending a letter to these Cherokee Nation citizens to let them know what the process is and who the contact is at Cherokee Nation's Contract Health Service?
We're not right now, but what we are working on is developing a brochure to be handed out to walk people through that. I introduced one 2 weeks ago, and we want to work on it a little more. There's so much information and so many ifs or what ifs, and we want to make sure we can answer as many of the questions that our patients have with that whole process. And we also want to work on a video that will be available on our Cherokee Nation website and hopefully answer questions as well.
Okay, and will you email that to us when it's ready and
Sure
post it
will.
on the website and let us know where the link is on the website when it's?
Absolutely. In fact, I may send it to you before we publish it, because
We would be happy to give
we
feedback.
talk a different language in health than, the average person does on the street, and we want to make sure that it's clear.
If that's at all possible, I know that we would like to see that because I know our constituents, this is like a daily, weekly question.
I understand.
Thank you, Connie. Thank you, Madam Chair.
Any other questions? Mr. Keener's next, then Mr. Baker.
Thank you, Madam Chair. All of the same questions I was going to ask you, so I want to ask you those again. But I did notice on the Will Rogers Health Center in your report that the public health educator presented a workshop on history and culture. You know who that is?
I don't, but I can get that information for you.
Okay. I appreciate that. It says that we're supposed to know about a Boys and Girls Club on Cherokee history and culture.
Okay.
So I didn't know how we were doing on history and culture now, so that's part of it, trying to find out on that. And then also, working on wings, do you work with them at all too?
I don't run, but they fall under health, they do.
Right, okay. So is everything going smoothly there with wings? And do we need to do anything differently to help them?
I'm not
As a
hearing
council?
anything. I hear the program is very well attended and there's lots of participation and
Right. When it comes to budget time, will we need to look at that more and closely to help them? Is that-
they have not expressed that need to me,
Okay, okay.
so.
Thank you, Madam Chair.
Counselor Baker.
Yes, thank you. I forwarded an email to you from a lady who was concerned about her 89-year-old mother and filling her prescriptions, that she had to punch in 100 numbers in order to refill a prescription. We want to know if there was some easier way to reset it.
Well,
How do you know what to
absolutely.
do?
I've met with Jeff Sanders in pharmacy and asked that we assign someone at each clinic to call elders when it's time to refill their prescriptions instead of asking them to call in. And so what we will do is have a person designated, and when it's 30-day refill time, they will contact the patient and verify the need for refills. And hopefully that will alleviate a lot of the concerns for the patients and for you guys as well. I don't know how quickly we can get that done. He's working on job descriptions right now, so, but I'm asking him every week.
Okay, appreciate that. Thank you, Madam Chair.
Counselor Hargis.
Several months ago, I talked to you about the vision insurance and how if you have vision insurance, you're paying more than if you didn't have it. Has anything been done on that, or have you talked to the insurance companies, or?
To be honest, I have not yet. It's on my list of things to do, and I know there was a meeting, I asked for a meeting with Northeastern to work on some things, and I haven't got a report from that meeting yet, but we'll catch up, and hopefully, if someone will make a note of that for me, we'll have something for you next month.
Thank you.
Thank you. If I may, I'd like to introduce our new medical director, Dr. Roger Montgomery. And also Brian Hill is the CEO from Hastings. This is Brian Hill.
Welcome.
I think,
Yes, I'd like to know how you set up the insurance program for each individual. If they're on contract, if they go to contract health and have insurance, are they thrown in with the people that don't have insurance and it's all put together? And
They're all
there's a
treated the
certain-
same, yes.
Okay.
But we're looking at that. I want to be clear on how we do that. I would like to see people with a third-party payer source be fast-tracked, if you will, or certain diagnoses that we know we're going to pay for, most cancers and most cardiacs. Why wait and do this process of reviewing several referrals in one day instead of doing them on a daily basis? So I'm calling it a fast-tracking of contract health referrals. And I hope to be meeting soon. I know Dr. Nolan has a contact that said that they could help us with the Choctaws, is it? That they've done something similar, so we would like to meet with them and see if we can implement something here.
I know it's hard for these people that have insurance to sit there and wait because, they're waiting a month, 2 months to be sent to a specialist.
No, I agree.
So then, if they've got the money, we need to put them on up
But all
there,
of
looks like
them,
the
you know, they
big.
should all be treated the same, because some people don't have the, good fortune to have a third-party payer source, and their need is just as great.
They are.
Okay, Counselor Byrd.
Connie, I was up Hastings Hospital the other day, and I guess it's a twofold question. One is, what was the original caseload that we were looking at Hastings Hospital when it was built? And have we seen the relief begin to take place by building these other surrounding clinics in our 14-county area?
Well, it was originally built to see 60,000 visits a year, and we're predicted to see 450,000 this year. So I guess the short answer is no, we haven't. We still see, I know Mitch ran a report for me the other day, and we see people from the 14 counties there.
Okay. Now, with that, is there plans to expand the current facility that we have? If it was it was originally for 60,000 and we're not getting close to 450, have we looked 5 years, 10 years down the road?
We are meeting and discussing that weekly, and I would like to, obviously, we're going to have to build something
Sure.
somewhere. Our surgery backlog is horrendous. On endoscopies alone, we're over 1,500 behind, and in years or time, that equals 18 months. And it's, screening for colon cancer is important, and we've got to do that. And so
Okay,
we're
thank you.
looking at ways to do that.
Thank you, Madam Chair.
Okay, next is Counselor Anglin.
Thank you, Madam Chair. Connie, you mentioned earlier about the 30-day prescription review. Where are we at on the 90-day?
Well, we're hoping if we can put the person in place to call, that we can do the 90-day refills as well. That it may be a call every 30 days, but it would be a workaround, if you would.
Okay, we're getting a lot of that up in our area.
I know.
Now, when we work the 90-day. First, want to make sure.
It's
we
estimated-
Keep it moving and
Yes.
keep it on the radar.
I know the sooner I can get a resolution, that'll be an opportunity for you guys to work on other things as well.
Yeah. Thank you. Thank you, Madam Chair.
Okay, Counselor Watts.
Thank you, Madam Chair. Connie, so want to make sure I'm clear, because in the past, I understood regardless of need, that was a blind review of contract health services for medical providers to determine who had the greatest medical need. And then we prioritized who was funded and who wasn't. It wasn't based on who could pay or not.
Right.
So are we possibly changing that philosophy?
No. It would all be the same, but there's just certain, like we know, as I stated, cancers are going to be approved. So why do we have to wait a week for it to be reviewed by a medical board when we know we're going to take care of that?
And that sounds like that's still within that philosophy of blind approval for medical priorities. But I'm also hearing that if maybe they have insurance, that they would get approved.
They wouldn't get any more preference than anyone else.
So will you have these policies in writing, and we'll make sure that our minds are clear, and we'll get a copy and we can share it with the public then too, if there's any changes?
Yes.
Okay.
Yes.
Thank you.
Next is Counselor Walkenstick.
Hey Connie, have the other the clinics relieved the visits for the Hastings Hospital? The other clinics around, have they relieved the impact of the number of visits?
No, they have not. I think what we see is more access and that more patients are using our facilities. So if you build it, they will come, and that is exactly what has happened with all of our
So
health.
people are just bypassing the other clinics and coming straight to Hastings?
Yes.
Okay. Another thing is, I know a couple nurses at Hastings, and they work this ridiculous amount of hours. I guess they're working 8-hour schedule, but their call schedule is severely understaffed. That's what they're telling me. and that they're working 18 hours, 20 hours sometimes. And we may need to look into whoever's supervisor over the staffing the nurses to check into that, to be certain. And that may be a reason. I mean, we got a lot of patients coming in there, and may just be scrambling, I don't know, but.
That's the first I've heard, but if it's like a surgery schedule, it's not uncommon for a nurse to work their 8-hour shift and then be on call, you know, for another 12 or 16 hours even. And
Yeah.
if they get called in, you know, they have to work long hours.
Yeah.
So, but we can, if we can meet and discuss
And
those
these
specifics.
are surgery nurses that I'm talking about. So it's just they're just really the ones I know. I mean, I think it's unsafe for the patients that they're going on that many hours working. So anyway, that's all. Thank you. Thank you.
Counselor Thornton?
Yes, Connie, I know in the year 2000, myself and Harold E. Moss and Don Crickman went over to the property in front of the hospital. There's 45 acres there, and we talked to the owner. And we eventually ended up buying that land. And the reason we done that was for extensions of that hospital. So the Cherokee Nation owns the property there. And what we need to do, I would think, is set up some kind of a deal with the federal government to help us build and extend on there. Is that what you're doing?
We're going to look at any opportunity that we have.
Okay.
We do know that IHS is not funding any more compacts for 2012, so that will be out as an option. In looking at the preliminary plans for that property, it's going to be pretty expensive to build over there because there's a 4-foot water line that runs through about 1/3 of that. So there will have to be a workaround for that if we go that way. And then the electrical access is going to be an issue as well. So we're trying to determine what we can do with that, or if we should maybe just move to another location.
Okay, thank you.
Do we have any more questions? Oh, Counselor Lay.
Thank you, ma'am. Connie, I see this CIH review summary. I see eligible, approved, deferred, denied. These deferreds, how do you keep track of them? Are they ever approved, and how many?
Well, I hope that, yes, we will keep count. And those, if they say deferred, then it's probably the ones that are sent back to the physician for more documentation.
So the denial is not, it's just on each month. I see 5/9, 5/17, 6/1. The denials would be only for that time period.
Yes.
The defers, we don't know what happened to.
It's a number of things.
Well, I mean, do they ever get fully
Oh,
funded?
we'll look back and see. Because, I mean, I think that's for just about a month of referrals that we've looked at. So if you want a carryover report included, we can do that.
I kind
Of
of
the
like to see that
defers.
because I see, 72 eligible, 46 deferred, if I'm reading this correctly. It's offset a little bit, it's hard to read. Total is 251 eligible, 156 deferred. That's a large number. I kind of like to see what happens.
Oh, I agree, I agree. I'm surprised, that we haven't spent more of the money for,
Sometimes I hear that we find out they're not Cherokee citizens.
Many
On
times
denial.
that's the
That's
case.
kind of, that was
or
kind
where
of
they live is a
eye-opener,
big
too.
issue.
Yeah. Thank you. Thank you, Madam Chair.
Counselor Garvin?
Thank you, Madam Chair. On this contract health they send in and you report back, I think we need to come up with a little better word than denial. That kind of shakes the person up. And it looks like it's no forever when they read that. surely we can come up with a better word than denied.
That's one of the reasons I use the word deferred, but we'll look at it that way. We'll see if we can find a kinder way
Say
to
we
put
need
it.
more info, or be patient, we just need a little, I don't know, just be a little kinder.
Okay.
Denied sounds pretty.
You can almost see a red stamp of that on there, can't you?
I'm sure you figure
No.
out something. Thank you. Thank you, Madam Chair.
Yeah.
I want to say, I agree with Counselor Garvin on that because so many people make an emergency trip to the ER and they gather up everything and turn it in, and I tell them ahead of time it's going to automatically be denied, and they don't understand why. And I said, well, that's just the way the procedure works, and then you've got to try the second time. And I understand what he's talking about there because, of course, we've got to have statements from the hospitals and the doctors and things to be turned in, but the way I understand the way the system works, all of them are denied the first time. They're written a denial letter, and then they call me or these other counselors and say, I was denied, and then we try to explain this all to them. Everybody's already, they're going to be automatically denied, and then you have to apply again. So I think it would be better if we need more information, or it's deferred until we get the paperwork that we need to be a little bit, not so harsh. Good idea, Councilor Garvin. Have any other questions? Councilor Jordan?
Yes. Connie, could you start including as a part of your report, information about Cherokee Health Partners?
Yes, as a matter of fact, they had their board meeting this week, and I've got those set aside to include. You'll get the financials and a full report of the number of patients seen by provider. It's a pretty extensive report.
If you would do a full report next month on their money taken in, money going out, who all we're serving, who all's on the board, how it all is set up,
Okay.
and then after that, include it monthly in your report, I would appreciate it.
Be happy to do that.
Do we have any other questions or comments for Ms. Davis? Okay, thank you. In all business, we've got discussion of comparison of healthcare provider salaries by Jody Fishenhock, and I think
She's asked that that be tabled for
she asked
discussion
it
next
to be
month.
tabled till next
Move
month.
to table.
All in favor? This will be brought up again next month. In new business, Councilor Lay and I have a resolution here for a grant. Councilor Lay, would you like to read that?
Oh, yes, Madam Chair. A resolution authorizing the submission of a special grant application to the Centers for Disease Control and Prevention, CDC, for funding to develop and build capacity to implement interventions. And I move for.
Second.
Moved and second, all in favor?
I move.
Any discussion?
I'd like to move, and I believe that has to go through tonight's
Right.
council meeting. Is that
After
correct?
we voted, we will.
Thank you.
One discussion.
Yes, one discussion.
Without objection from the sponsors, could I be added as a co-sponsor?
Yes, anybody else want to be added as sponsors?
Okay.
Okay. Does everybody want to be? Anybody that does not want to be added as sponsor, just, we'll all be added as sponsors. Okay. Okay, all in favor? Aye. Any opposed? This passes, and now we need to vote on sending it to full council tonight.
Actually, we'll have to amend the agenda tonight.
I think we instructed that it go to full council and we'll just amend tonight.
Oh, okay, all right.
I'm sorry, Madam Chair, I believe we'll have to
Okay.
amend it tonight.
Do we have any announcements? Yes, Councilor
Madam
Lay.
Chairman, I think Ms. Davis might want to talk to us about home health care. Was there something that you wanted us to do, to discuss today? Maybe a little out of line.
Go ahead.
If you could come forward and motion.
There was discussion about moving home health services, hospice, and the PACE program under health. And just to let you know, I'd be willing to help in that if you're interested.
We don't have that legislation up, but in other words, you're asking that we do that, more or less, entertaining the
Yes.
next time. Okay. Something for us to think about. We need to get it on the agenda. So, yes.
I would ask that such a resolution be prepared and be placed on the agenda for health next month.
Second.
Second, okay.
Well, actually, we can't take a vote, we'll ask
Suggestion.
You reckon?
Connie.
because it's not on the agenda.
Right, okay.
But we can ask, we just starting our agenda for next month, and that'll be the first thing, and I'm looking at our attorney to prepare that. And I'm thinking, Mr. Lay, you're wanting to be a sponsor of that, aren't you? I would also like to be a sponsor. Would others want to be sponsors of that? You might take these names down, Diane. Everybody's got their hand raised.
Well, after you draft it, then I'll decide.
I will, I'll put everyone's name on it, and then you all can figure out if you want to, I'll start Madam Chair.
Okay.
Thank you, Madam Chair.
All right. Thank you, Ms. Davis. We have any announcements? If not, the next meeting is August 13th, and Mr. Thornton has made a motion to adjourn. Second. All in favor? We are adjourned next month.